Rafina. We'll go on to the next one. Dr. Athul is here. Yeah. He'll be presenting on 3D printed LAG, which is Lens Attachment Guard, a novel protection system for lenses used in ophthalmology. Can I request Dr. Virender to please step in as a judge and comment on this? Dr. Sitanshu Mathur had to be unavoidably called for some other work.
Good morning, everyone. I request all of you to take your phone out for 2 seconds and kindly turn it around. So what do you see? Does it have a case or a cover? Is your phone protected? You all might be having expensive phones or normal phones, but you want to protect it, right? Then this innovation is for you as an ophthalmologist. It's Lens Attachment Guard, a 3D printed attachment guard, a novel protection system for lenses used in ophthalmology. So how did this begin? It began when I saw lenses breaking in the retina clinic laser room. It can be due to accidental slippage, due to the patient factor or doctor factor. And all these lenses are very expensive, mind it. So we decided to find some solutions. First, we tried some soft flooring, so to give it a cushioning effect. Then we tried covering it with M-seal. But then we wanted something more solid, something more robust. So we decided to design and 3D print a new novel adapter. We wanted a mounting mechanism to put it onto the laser slit lamp, and we went on to prototype and pilot test it. So we wanted the innovation to hold the lens firmly, easy to attach and detach from the lens. It should not interfere with the corneal contact region, and it should be either mounted onto the slit lamp or to the wrist of the surgeon, so that in case it slips, it doesn't get in contact with the ground or the floor. And it shouldn't be a hindrance to the working area. And obviously, in India and anywhere in the world, it should be a low-cost solution. So we first CAD designed it, then we printed it in thermoplastic polyurethane, and we developed the first prototype in Hackathon 2.0 last year. And it consists of 3 main parts: a winding clip, a thread lock, and a lens holder. You can see the PRP Mainster PRP 165 lens hanging from the Pascal forehead mount of the laser slit lamp. So how this is set up? So first, you have the adapter. This is the first prototype, and we have to fit the PRP lens into the adapter, and then, as you can see, it is ready for application. We have put a wire tag there, and we can mount it onto the forehead and then align it, and then you can start lasering. And it can be removed again. You can wash it. The visco can be washed off. So now recently, few months back, we went on to develop the next version, LAG 2.0, with assistance of Orolab. It has a thinner footprint. It is comfortable to hold and no hindrance in any case. You can see the thin footprint. It is really thin, but at the same time, it does the job. So why not? So we thought, we have protected PRP. Why not protect all the lenses? So we developed for 90D. And since some might be having a black 90D or a blue 90D, they might want to change the color, like you change the case of the your mobile phones. So we thought, why not do that? Why not give the surgeon more options? Youngsters might be wanting more colors, more modulations. So we also developed for 20D as well, to prevent it from inadvertent falls and breakage. So we thought, how about some aesthetic variations? We went on to design more designs and give it more appealing to the eye, and also appealing to the patient in pediatric clinics when you have something colorful to be used. So I believe this provides adequate protection for ophthalmic lenses, and various color options are available, and we plan to make it easy on the pocket. And a drop test with the lenses are pending. We are awaiting funds to acquire more lenses so that drop tests can be done. Drop tests have not been done yet. Thank you.
Thank you, Dr. Virender.
Yeah, thank you, Atul, for having a innovative idea. My only feel is that this is required for the lenses which are having a rim, like gonioscope or the capsulotomy lenses or these kind of lenses. But probably it's not required for 90D and 20D.
Yes, sir, definitely,
because
sir.
it will not make any difference to them except making them slightly more bulky.
Yes,
and
sir.
I don't know how much weight it will add on to the 20D, but that can also be an issue.
Yes, sir.
So, but rest all the idea is good, because the lenses like capsulotomy, I got myself broken because it fell. Yes. And these are the things which are very costly nowadays.
Yes.
Almost capsulotomy lens is 40,000 rupees.
So the idea is mainly for those lenses, 90D and 20D, just like accessories.
Yeah.
Just you can give it as a gift to somebody, or just like a color. You can have a different colored 90D every time you go.
Another idea is to match the color with your dress.
With your dress, yes, very nice.
And you can print your name also on it if you want.
Yeah.
on the lens.
And these can be removed easily, or
Yes, sir, very easily. Just
so
like
they
how
are
you remove your
flexible kind of thing.
flexible TPU for now, but we are planning to make it into silicon. Silicon requires a hard molding printing, and so it's a more expensive process. So we are moving on to
Because
that soon.
sometime when you are maneuvering to put the cover on it, it can have a reason for fall because you are taking it out with some force. So I think be careful for that.
Just like we take out case from the phone,
Yeah.
similar mechanism.
Yeah.
See, if you look at the breakability of a lens, it is usually the contact point which breaks
Yes, sir.
rather than the rim per se.
Yes, sir. Yes, sir.
Because those are all already in the metal. So adding to it is not going to help, except that it does not drop because of the strain.
Yes, sir. For the
So the
PRP
only
and gonioscopes, the
Yeah.
aim is to prevent it from falling
Exactly.
down. And for the other lenses, it's just to give it an aesthetic appearance.
The only challenge is that even if it is suspending, when it drops down, it shouldn't hit the other part of the slit lamp.
Yeah, that is also we might have to look at the the arc. If you see, it's falling from the forehead. So when you look at the arc of how much like a pendulum, if you see, we tried it once, like to drop it. It did not come in contact with any part of the slit lamp, laser slit lamps. We tried it on Iridex and Pascal slit lamp. It did not happen.
No, one question is, you said the young people like colors. What made you think that old people will not like
Don't
colors?
like colors. And you must be
His
very
complex
sensitive
is
towards your terminologies. You must know that all of us are on the better side of 40. So